Hi, this is Erica Penrod from Group 4, and this will be our oral report for our International Health Project. As I said, I'm Erica Penrod. I am a senior in my last semester in Logan, Utah, and I'm studying public health.
Hi, my name is Nicole Strother, and I am also a senior in my last semester, and my major is public health.
Hi, I'm Gabriella Carollo. I'm in Pocatello, Idaho right now, and this is my third to last semester studying public health with an emphasis in health education and promotion.
And hi, I'm Deborah Kadelka Beavers. I live in Prescott, Arizona. My major is healthcare administration, and this is my last semester.
All right, so today we're going to be talking to you guys about malaria, but specifically malaria in a village in Kofikwe, Ghana. Malaria is a disease that's spread by mosquitoes, and so basically wherever mosquitoes can thrive and where malarial parasites can thrive is where it's going to be at. So very warm, hot, humid places is where a lot of malaria infects people, and sub-Saharan Africa is the biggest section where malaria exists. And it troubles mostly people that have lowered immune systems, so pregnant women and small children under the age of 5. It infects the blood, and it can be diagnosed by looking at a blood sample through a microscope and identifying the malarial parasites. Once a person gets infected, often they experience fever, vomiting, and headache, kind of like flu-like symptoms. When you get malaria, or when pregnant women get malaria, they can transmit it to their unborn baby, and as a result, it can often lead to low birth weights, which really increases the risk of a baby not making it later in life. So the kids that do survive malaria, getting malaria, they're often left ill, maybe with brain dysfunctions or convulsions. And it is an issue that does prevent many children from going to school and learning. So Ghana is one such country that does suffer from malaria a lot, and about 20,000 children die from malaria in Ghana each year, and 25% of those deaths are children under the age of 5. And so Kofikwe also, which is located in Ghana, also shares statistics like this, and it's located on the eastern part of Ghana, and it's a small town where there is a lot of poverty, and it has a population of less than 2,000 people.
So our research found these viable solutions to the malaria problem for Kofikwe. First was educational material. Educational material is always important as it helps to instruct individuals on how malaria is carried, what the effects are, and how to avoid exposure. It can be written in their native language, show pictures, and to help dispel superstitions and myths. Pamphlets can be written such that children can learn from it as well. Educational materials can also address in a non-threatening manner gender issues such as having only women retrieve water from local springs and rivers, especially during pregnancy. These pamphlets can also address simple abatement solutions, such as the importance of good drainage around the home and minimize any standing water where mosquitoes can breed. Another solution is mosquito repellent plants. Plants such as citronella, lantana, rosemary, and thyme have been found to be effective when planted around door and window openings to repel mosquitoes from entering into the home. It is thought that the strong smell that these plants emit masked the scent of human hosts that mosquitoes are attracted to. These hardy plants, once established, require no maintenance and no additional cost. And according to the plant hardiness zone map, all of these plants could thrive in Ghana. And another solution is insecticide-treated nets. Insecticide-treated nets, called ITNS, are a form of a personal protection that has been shown to reduce malaria illness, severe disease, and death due to malaria in endemic regions. In community-wide trials in several African settings, ITNS have been shown to reduce the death of children under 5 from all causes by about 20%, according to the CDC. Only pyrethroid insecticides are approved for use on ITNS. These insecticides have been shown to pose very low health risks to humans and other mammals, but are toxic to insects and kill them, even at low doses. Pyrethroids do not rapidly break down unless washed or exposed to sunlight. Several companies have developed long-lasting insecticide-treated nets called LLINS that maintain effective levels of insecticide for at least 3 years, even after repeated washing. Another important solution we felt was partnering with other organizations that are already established in Ghana. And our partner is Nurturing Nations through Laura Belk and Percy Gogo.
So as we examined these solutions, we encountered some barriers. The first and one of the biggest barriers to any of these solutions is the geographic location of Kofikwe. It is on the southwestern side of Ghana, near the capital, well, roughly near the capital city of Accra. They are very rural, remote, and isolated. There's not a lot of infrastructure or reliable roads, ways to get anything, information or goods into this village. Another big barrier to potential solutions is the culture. Many of their local beliefs are driven by superstition and custom and tradition. Frequently, when Western medicine has been brought into this region, it's very suspect. They're not interested in any of the information or drugs or healthcare. So that has to be addressed in a culturally sensitive manner. We have to be aware of their beliefs and not discredit those. Specific to the solutions we came up with, we found that printed literature is highly regulated in Ghana. According to the Ghana Revenue Authority Customs Guide, literature, scandalous books, newspapers, and printed material, which is in the opinion of the commissioner, is absolutely prohibited and restricted. At minimum, this would be a huge delay to bringing educational materials to the people of Kofikwe, and potentially it wouldn't be allowed at all. The same authority cites that plant product, plant disease, or pest, soil, manure, grass, or any other plant material liable to harboring dangerous disease or pests is subject to regulation. It would be time-consuming and expensive to get the permit required to bring seed packets into Kofikwe. And finally, we found that although the government of Ghana has implemented a mobilization plan for malaria control, they're running out of funds. And so it's kind of a mess. They had a plan to distribute nets to all of their citizens, but it's kind of halted and is not going well. So there's also a smuggling trade between countries with these nets, and that also contributes to the regulation of the nets. So we found that our best option would be to buy the nets, to raise the funds and send them to be purchased in Ghana, which is where Percy from the last slide comes in. He is a native of Ghana living in the capital city of Accra, and he partners with Nurturing Nations to spend the funds within the country, is an excellent, trustworthy guy that sends documentation back of every purchase and every distribution of goods, because in such a in a country dealing with so much poverty, there's a lot of corruption, a lot of dishonesty, a lot of funds that are used improperly. And so we feel very confident in Percy's ability to spend our funds in an appropriate manner.
Okay, and then so after we went through all the solutions and we hit all the barriers, we wanted to do as much as we can, but we know our barriers were limiting us. So we came to the conclusion that we would overall focus on the insecticide, treated bed nets. We found that that would be the most impactful, and it would be easier for us to make it manageable for them. So our goal was to get these nets to the village as soon as possible. And then after some research, we came to the conclusion that it would be about $2 for these nets. And we found that these beds would hold up to 2 people. And as we stated before, we decided that purchasing these nets in Ghana would be the easier and more fastest route to get it to them instead of shipping them directly to them. So in order for us to accomplish this, like we stated before, we did make some connections that we were actually super grateful for. We've been able to speak directly to Laura and the help with Percy as well. So they have helped us with understanding what exactly the village needs most and what will be the most successful. So instead of us just having to guess and overall just think about what they need, we actually knew exactly just because we had direct contact with people that have been there and that are already working with them. So Laura has helped us to understand some cost factors as well. And like we said, we're going to be purchasing those nets directly in Ghana instead of having to deal with the shipping standards. So we plan to fund this project just on our own. And we decided as we take these, the overall cost of buying the nets and getting them out there, we would split the costs between the 4 of us. And then from there, we would fund it through church, work, school sources. So, for example, just running fundraisers, having donation bins, kind of promoting it in our community as much as we could. And like I said, when we decided to split those costs, we would think that the funding would come pretty quickly if we all decided to kind of work our own for one price range and then come together. So overall, this project has been very impactful, and even on us ourselves, we really enjoyed to be able to work with Laura and Percy and be able to see what they exactly need. And it's been wanting us to be able to work on this project even outside of this class. And just having to be able to continue and focus on this international project, we want to be able to implement it more in our communities.
Yes, and just to final this presentation, here are some pictures of the actual children in the village of I can't say the name of the village, but it's in Kofikwe. And as was stated by our team, that we were touched by the plight of this small village. And we are going to actually, after this class is over, actually do this project and fund these mosquito nets to these children. And we thought that this passage out of 1 Nephi kind of summed up our feelings, and that is, "For I will contend with him that contendeth with thee, and I will save thy children."